Welcome back to Ask the Doctor on Periscope. I'm Dr. Mark Vaughn of the Auburn Medical Group, a family medicine physician in Auburn, California. And this is Ask the Doctor, where we go ahead and address questions that you come up with. And do we have any, you just let me know when you see something, read them out, read out all the comments, read out whoever says hi as fast as you can keep up with them. And we'll go ahead and address whatever people want to talk about. If you want to talk about, I don't know, interesting medical subjects you saw on an X-Files episode. I say that because last night I learned about X-Files being made again, and that was kind of exciting for me because I used to try to watch it on occasion as the only television show I watched while I was in my first year of medical school, believe it or not. Well, maybe some of The Simpsons, hard to remember back. We didn't even have a television, so that's why.
Someone says they have a spot on their heel. Is it concerning?
It may very well be. We can't. Spots on the heel can be anything from nothing to something very serious. So that's not something that really lends itself to Ask the Doctor on Periscope. So maybe there's something else that would be. Anything else?
Somebody else is wondering about the rash biopsy.
Yes. I'm glad they're interested in the rash biopsy. I am interested too. It's just a matter of, it takes time for the pathologist to do the work to do all the, well, here's what they have to do. They get the specimen, which you guys saw when I took it out on a previous Periscope, and then they have to section it, and then they have to stain it. And sometimes the staining process itself can take an entire business day. And then the next day, it'll get put in a queue for being read by a dermatopathologist, a pathologist who specializes in looking at skin biopsies. And then they'll look at it, and then they'll generate a report, and then that report will be transcribed, unless they were able to type it or do speech recognition. And then it gets put into a fax machine and sent to us. So the whole process, for some of them, will take long enough that it's not here yet, but it will probably be here tomorrow, I would guess, most likely. Also, sometimes they'll have to have it read by one of their colleagues because they can't tell just on the reading for sure what it is. It may look like a couple of different things, 3 different things, and they'll have a colleague look at it, and that takes more time because it has to get put in their queue to have them look at it. Do you have something else to...
Somebody asked about how to get overweight kids, like healthy ways to...
Yes, how do we get the overweight kids to be healthy and to live a healthy lifestyle? Lock them out of the house, that helps, because they sit down and they don't move around much when they're inside. My mom used to do that to me. I can remember being locked out of the house and being told I need to go outside and play. Of course, there's some neighborhoods you may not want to do that.
She said without giving them a complex.
No, don't worry about the complex. Lock them out of the house. Tell them it's good for them, that you love them, and they need to get exercise. And that's not true just for overweight kids. That's true for kids who aren't overweight, that they need to be getting exercise and need to not spend all summer inside the house playing video games or eating chips. Oh, that's another thing. Don't even buy simple carbohydrates. Don't even buy chips. Don't even buy crackers. Don't even buy pretzels and cookies for them to get into. Don't even have them in the house. Or consider locking the pantry if they're around and then using them for, as they should be, for a special treat or dessert, and in a modest amount if you're going to be giving those to kids. And try to give them a good breakfast in the morning so they're not having to be snacking all through the day so they don't feel as hungry. Those are some tips I would give. Any other comments, questions?
Somebody asked if you have mono, is it true it stays with you for life?
Oh yeah, the Epstein-Barr virus is, at least there's an antibody to it in your body. Some people will have different syndromes that we think may be. One of them is called chronic fatigue syndrome, that can come back later, and it does seem like it may be a reactivation of the Epstein-Barr virus. It can cause other problems too. It can cause hepatitis. It can affect other areas. A lot of it is speculative because we don't have a lot of data on the Epstein-Barr virus and for sure what it's doing. I am speaking a little bit out of ignorance here because I don't know myself if it's actually a reactivation of it or if it's thought to be due to the body's immune reaction to having had it in the past. So, but yeah, there is something that does stay with you. The mono itself clears up, and you don't have mono anymore. Next. She's trying to read it. She's making faces. Does it need to be blocked?
No.
Okay. So if it needs to be blocked, you just tap on it and then tap on block. But
somebody said they get herpes on their lips in the sun.
Yes, that's right. That's right. Sun will bring out the Epstein, not Epstein, the herpes virus. We usually call them cold sores when they're on the lips. Herpes simplex, there's types 1 and 2. Type 1 is most commonly associated with the mouth. Type 2 most commonly associated with genitals. Type 1, just contact can spread it. Mothers kissing their babies can spread it.
Let's say, how do you prevent it?
Prevention, well, sunscreen, keeping the sun down. You may be able to do suppressive therapy with antivirals that work on the herpes virus. There are 3 of them: acyclovir, fancyclovir, valcyclovir. I think there's more, but those are the ones that came out first. 2 of those are generic: the acyclovir and valcyclovir. Famcyclovir might be now. It's also called Famvir, and these can be given daily, at least for the first year after you have your first outbreak of either genital herpes, and you can also do it for oral herpes too, and it keeps it from coming out. So talk to your doctor about suppressive antiviral therapy for your cold sore.
Do hemorrhoids go away?
They can stick around a long time though too. Now hemorrhoids, when they first start, they'll be kind of, I won't say hard, but they have blood in them. There's something inside of them. When they get absolutely hard because there's a clot in them, they're not dangerous because there's a clot in them, but they are painful. And then the ones that over time the blood has resorbed and gone away, they'll be almost like a skin tag and kind of squishy, and those tags can stick around a long time. Hemorrhoids themselves can stick around a long time, and they do. You might want to get checked out for the possibility of getting relief by having an internal hemorrhoid banded to help resolve the outside hemorrhoid. You look like there's something.
Oh, do you know anything about periodical catch syndrome?
Periodical catch syndrome.
They said their doctor said it's not treatable, because that's what it says on Wikipedia.
Periodical catch syndrome. That sounds like what some people refer to as a stitch, which is just a muscle spasm in the chest wall. Or
precordial.
Precordial catch. Okay. I believe what they're talking about is an intermittent pain in the chest. I'll go ahead and talk about that since that's what I think it's referring to, but it may not be. I'm not as familiar with that particular term. People would get a pain, sudden pain, acute pain in the chest wall, and they can't take a full deep breath. In fact, they may even reach for the chest and kind of hurt and breathe shallow for a little bit. And this is in a person. Kara, do you remember seeing me do this morning? Do you remember seeing me kind of grab my chest?
Yeah.
Yeah, I had one this morning. It's not that unusual. There are many muscles in the chest wall, not only on the outside. You got the pectoral muscles that operate the shoulder. Underneath those, you have muscles between the ribs and even on the other side of the ribs. So there are lots of muscles that are used for respiration. And of course, they stretch when you take a deep breath, and it hurts if they're in spasm. And it resolves by itself. I don't know of any particular treatment you use for it because it goes away as quickly as it comes, in most cases. If yours doesn't, that'd be something to get checked out. Next.
Somebody works in a hospital and they're wondering what some good lotion is for too much of the foam mush.
Yeah, it's starting to irritate the hands and they're getting a little red and crackly. Certainly if you can change what it is that you're always putting on, that's hard to do when your hospital only purchases one particular kind of, whether it be hand sanitizer or the foam. You can use home products, but see, here's the problem. The more stuff you put on the hands, oftentimes the worse that they'll get. So a lot of times these can be serious enough that we recommend having a dermatologist make a specific recommendation to whatever your type of eczema or possibly contact dermatitis may be. And that's the thing. Over Periscope, we can't tell if we're just talking about an irritation or a true contact dermatitis that needs to be treated with some prescription medication. You have something else there? No questions right now?
Oh, is your pen black or blue ink?
Black. And it's not mine, it's from Auburn Eye Care. That's who I go to for my eyes. And they're just across the street, so.
Okay. Is there a clear answer to how tight my jeans can be before they cause testicular problems? And he says serious.
Oh, that's why I'm laughing very seriously. I'm supposed to come up with how many millimeters of mercury when we put some kind of a pressure sensor in your pants? If it is a serious question, it's kind of hard to take it seriously because you're not telling me what I'm supposed to measure it by. How many people point at you when you walk by on the street? I don't know.
Somebody said they had Bell palsy in 2002 too, and they're wondering if it will,
If it can
Get
come
better.
back,
Or
recur.
if it'll get better.
Well, Bell's palsy usually goes away just within 6 to 8 weeks at most, with complete recovery. If there's residual symptoms, that should be checked out, because that is not normal to have residual Bell's palsy. Of course, it can be caused by any number of things. What are you laughing at?
Somebody said you look like a skinny Dr. Phil.
A skinny Dr. Phil. I think I like that. I think I'll run with that. My Twitter handle is now the skinny Dr. Phil from Auburn, California. What are you laughing at now?
Mustache on fleek.
On fleek?
So many people say.
What's?
It's perfect.
It's perfect?
Pretty much.
It's perfect?
Yes.
That's what they're saying? It's perfect? My mustache is perfect?
It's on fleek, yes.
Okay. Thank you, I guess. Is Dr. Phil's perfect?
And they're asking how true it is that your phone can cause cancer.
My phone?
No.
Drop it.
In your pocket.
We don't have any hard evidence to show that. The problem is, first of all, you have to specify which cancer we're talking about, because cancers are different. Cancer is not a single thing, even though we give the name cancer to all of these different types of cancer. So a particular type of cancer, I think they're most concerned about actually cancers in the head, where the phone is held when people are talking, not, for example, testicular cancer or ovarian cancer when it's being held in the waist pocket, pants pocket. The other one that's often talked about is the overhead high tension power lines. Both of them are talked about in the question of, do these cause a particular type of brain cancer? Unfortunately, the type of brain cancer they're talking about is so rare that you can't get enough data. You know, the baseline occurrence of it is so rare that you can't tell if, and cell phones are so common that you can't tell if a particular case of it is from a particular exposure to high tension lines or to a cell phone. And we just don't have enough statistical power of any sort to look at these. And of course, all the studies at this point that we have are retrospective, looking back in time. And there's problems with retrospective analysis because you end up finding things that aren't really connected just because the investigator who's looking is looking for the connection. And when you look for connections by looking at historical data, oftentimes you will find it even though it wouldn't be there if you had done a prospective or looking future study where you say, okay, here's the people, we're going to put some of them with cell phones on their heads and some of them without, and after 10, 15, 20 years, we're going to see if there's a difference between the two groups who are otherwise similar in their incidence of a particular type of cancer. So the short answer is no evidence for it. The summary of the long answer is, if there is, it's going to be hard to tell, and it's going to be very small risk. What were you laughing at? What are they saying?
I don't know. Nothing.
Okay, all right. So we're at a standstill. Let me see if we have the patient ready yet. No, not yet.
Is your mustache real, or is it a disguise?
Is this the same person? Can you tell?
I don't remember.
I'm actually disguised. I'm truly Dr. Phil in disguise right now. It's not really me.